people who have a emotional trauma, and it can be happy. Small amounts are like very happy things, but most are associated with either a personal emotional trauma or also with natural disasters. They come in with a sudden onset of these symptoms of chest pressure or palpitations, weakness, feeling terrible, just like they're having a heart attack. But on exam, it turns out the arteries are normal. It's not a heart attack. It is this Takotsubo cardiomyopathy. And it's totally biologic. I mean, it's stress hormones, it's inflammation caused by those emotions in our brain. Anybody that has these types of symptoms of chest pressure, pain, palpitations should go to an emergency room immediately and be evaluated. And it's important that this occurs more frequently in women than men. It's very moving taking care of these people when they have that realization that this emotional event is what caused their heart. I had one gentleman who was talking with him and his wife about, that this is what we thought the diagnosis was. And I said, have any emotional things going on? And they looked at each other and they both started sobbing. We lost a baby. And I mean, it's just like a real, I think, moment for people of recognizing that heart-mind connection and what it can really, do to us. I would say I see a case at least twice a year. In a case that's bad enough to be admitted to the intensive care unit. This condition can cause sudden cardiac death, and is associated 5 to 10% of the time with sudden cardiac death. So again, if you have symptoms, go to the emergency room right away, because if you wait too long, you may not make it. If you have symptoms like this, it could be a panic attack, which can cause palpitations and chest pressure. It's important to get checked out. Panic attacks tend to be recurrent and less severe than this. So obviously, check in with your doctor if you're having any of these symptoms. Most of the time, we can just take the patient in the hospital and they will recover with time and supportive care.